Actually, it's our great honor to have both of you, Dr. Neha and Dr. Shahi, in this interview, which is done under the Medical Student Council.
Thank you for inviting us.
Thank you.
Thank you. It's a great honor. Actually, it has been done this interview before, but this is the first time that we have done it for a married couple. So, are you ready?
Yes.
Hope so. Hope so.
Let's get started. So, let's start with Dr. Shahi. Tell us about Dr. Shahi. Who is Dr. Shahi?
Myself.
Yes.
Okay, I'm an orthopedic surgeon. I was coming from the northern part of India and did most of my schooling in my hometown. So I must say that I don't have much experience of a hostel life. Yes, but throughout I have been a good scholar and a reasonably good clinician. Came here in Saudi Arabia 2014 with a small skepticism of whether I would be able to survive here or not. But after 6 months I realized this is a wonderful place to be.
So, Dr. Shahi, speak about your journey from medical school until a doctor in KFU.
Okay, as for any medical student, the journey was long. It is requiring a lot of effort from me and my colleagues as well. Every time of point I was thinking of why did I choose this profession? Should I quit? Did I choose the right profession? Because as I've told you, this is a long journey. I think all of you must have experienced that as well. But at the end, when I get to treat my first patient, when I had the joy of seeing him walking again after as he came as a bag of bone to me, the whole 10 years of my hard work actually thought, okay, this is something which I have done my hard work for. So yes, I will not say that I did not question my decision of being a medical student, but yes, it is rewarded well. As far as coming here is concerned, there are few reasons and few things that made me come here. One of those was the life of a surgeon is very hectic back in India. I was doing my academic job as well as my surgical practices back in India. The problem was that I was not having ample time for my family. And for whom we are earning, for whom we are professionals, it's the family that should come first. So my daughter, when she was a year old, I used to bid her good morning and bye in the morning when she's sleeping. And when I used to come back at home, she was to bed again. So in the weekends maybe I happened to see her. So I must say that I lost a lot of her childhood. That was my primary reason to come here. After coming here, as I've told you before, I had my own suspicions whether I'm taking the right decision. Because for a surgeon, going and taking a decision of shifting his place, because I started working and people started recognizing me back there. But then I realized I have to do this for my family.
Okay, so since we talked about here in Al-Ahsa especially, what do you think? What are the local customs here in Al-Ahsa that you did like and those you did not like here?
Okay. If I say that, especially for Al-Ahsa, there's nothing I don't like, that would be a biased opinion, but indeed it is true. Especially when I came from a background, people gave me a lot of information, mostly not so good about the whole region here, that okay, this is very strict, this is this, this is that. So I had a very low expectations from the place. And I got a very wonderful welcome from the local people, from students, from faculty, from the management. So I thought, okay, there are some dark sides of the place yet to come. It's been 4.5 years. I still am searching for something that I could say that this should not have happened to me. My neighbors, they're mostly Saudis. They never took me as an outsider. They meet me, they greet me, they call me for their occasions. I call them for my occasions, and they participate very well. So I'm sorry to say that I don't have any negatives for this place. A lot of positives. You will extend your interview for 3 hours, and I will not stop saying about the positive things of this place.
Okay. So moving to the last question, which is also an important question: why Dr. Shahi has chosen orthopedics as a specialty?
Okay. Primarily, I chose it because of two reasons. One is I wanted a flair of surgery with not leaving my touch with medicine. With my medical school, I scored much better in my medicine subject rather than the surgery. That's just for the records. But I liked making the diagnoses. The only thing which was getting me away from the medicine was they were not treating many diseases. It's mostly the symptoms they treat. I want to do some radical correction for the treatments. That's what my aim was. But general surgery is all about cutting. Once the medicine people, they refer someone who is untreatable by pharmacological means, they go to surgery. So we don't think of much conditions, though there may be some, but much conditions which can be treated medically as well. So orthopedic had a flair of both medicine and surgery. That's the prime reason. Secondly, it is one of the most earning branches. So that was behind my mind as well.
Okay, let's move to Dr. Neha. Tell us about Dr. Neha. How is Dr. Neha?
Okay, Dr. Neha, first of all, Neha means love. The meaning of my name is love, and I'm a happy-go-lucky person. I like talking a lot, as my students know. I don't let them talk much, and I'm a very lovable person, and I like truth, and I support truth, and I'm the eldest in my family and the most loved one. So the journey from the beginning, has been wonderful for me.
So, as has been asked for, Dr. Shahi, talk about your journey from medical school until a doctor and came here.
I have 3 generations of doctors in my family. So it was, but even after that, it was never a compulsion to become a doctor. I became doctor by choice, and it was my own decision, and I had been supported at every step by my parents, by my grandparents, my grand-aunts, my aunties. All of them, they're doctors, and they supported and guided me throughout my medical field. So it was an easy journey, and I believe there was a lot of expectation from my own side that I tried to fulfill, and I believe I succeeded also. And for choosing a subject in my post-graduation, that was microbiology, there are a lot of clinicians in my family, and when I chose this subject, they asked me, why are you choosing this subject? But I had a valid reason for that, and I tried to succeed in that subject also. So my aim was quite clear from the beginning, and I'm still trying to give as much as I can to the society by being a good doctor.
Okay, as per microbiology concern, why did you choose microbiology specific while you have other options?
Yeah. Well, my marks were so good that I could have chosen ophthalmology also and other subjects also, but I chose microbiology because, you see, I feel this is a spine. Now you may ask how. So if the person is a medicine doctor or a dermatologist or a surgeon, what is one thing that all of doctors do? Write investigations. And without investigations and help of investigation, you can never lead to a diagnosis and help a patient. So I believe a lot of research and a lot of scope of knowing and curing people is in this field. And I was very much academic oriented and research oriented, so that I targeted my field towards, targeted my views towards a field that I can help the doctors as well as patients to come to our diagnosis and get treated and get well.
Good to hear. So what do you think? Do you agree with Dr. Shahi or not in the concern of local customs in Al-Hassan, Saudi Arabia?
Okay, so I came 1 year after Dr. Shahi, but I had a warm welcome from the first time only, because I had given an online interview here. People here are really warm. They are so understanding, even students, parents, teachers, colleagues. So I was nervous because I heard that women have to follow more rules as compared to men, but I felt comfortable, and I imbibed it, and I respected it, and I indulged into it so comfortably that I have not faced a single problem. This will be from September, my 4th year starting, and I am happy here. And the best part, I'm happy because I have my husband here. I can spend time, we can have coffee, tea. I love kawa. We can have Arabic coffee, and I love my students. They are supportive, understanding, and my academic zeal is alive here. That is what I like.
Okay, moving to the questions, which is for both of you. which is everyone is waiting for. So how did Dr. Shahi and Dr. Neha met?
Okay, back at my place, both of our families, they belong to a conservative society, class of the society. So, though, like, there were certain options available for us, but for us, it was our duty to give this honor to our parents. So, it's been interestingly, we study from the same college. She's 2-year junior to me in the same medical school, but we haven't seen each other till the time I went to actually meet her. I finished my medical school, I did my United States medical licensing examination, I went to United States, traveled there for around a couple of years, came back to know that someone is waiting for me in my own institution.
Okay, do you want to add something?
Yeah, I want to add one more thing, that this is a good thing that our families choose the boy, but we as girls also, we get that value to decide whether we want to marry him or not, and we look for a lot of factors that all the girls they wish for. And you will not believe, the one factor that I told him when I first met him was, I want to study more and work, because there's quite a lot of uncertainty related to this topic, but he, being a gentleman, he promised me and he fulfilled his promise. And I'm a postgraduate assistant professor sitting in front of you, and he's still helping me and motivating me to do more research and study and progress in life. So that's a good thing.
Okay. So let's move to Dr. Shahi. Dr. Shahi, do you consider Dr. Neha as a good cook?
Cook?
Yes, cook.
Okay. She's definitely a foodie. As far as cooking is concerned, we actually, both of us, experiment. Sometimes I bother her with my cooking. Sometimes she bothered me with her cooking.
Okay, what is the best dish that Dr. Neha has been doing?
Maggie.
Yeah, I'm a Maggie cooker. That's the best I can cook.
Okay, Dr. Neha, what is the best gift that you have received from Dr. Shahi?
Okay, so the best gift, of course, with both of us, is my daughter that I've got. Her name is Sanvi, and she's 7.5 years old. And when we have kids, not even have, when we are in a planning way to have kids, we imagine the kids to be our childhood. We want to see our childhood in them. And so my daughter, she complements both of us. She looks like him, but she's completely like me, naughty, mischievous. So both we are reliving our childhood in her. And apart from that, I've got a lot of diamonds that every girl wants from him, and every year I make it a point that I get some gift. So Dr. Shahi has been giving gifts for, I think, past 9.5 years, and I hope inshallah it goes on and on.
Just sorry to interrupt you regarding our daughter. What we used to say amongst ourselves, she's a hard copy of me and a soft copy of her.
Yes, that's it, in a better way to put it.
Okay, I will ask a question. You have to write the answer in the board. No one should see what others is writing, and show it to the camera. Okay, what is Dr. Neha's best color?
Okay.
Great. Okay, another question. Okay, excluding medical occupation, what occupation that Dr. Shahi likes most? Other occupation. Okay.
That's not an occupation, that's a hobby.
You could have made it as an occupation.
Yeah, actually I've made it to university.
Okay, what scares Dr. Neha the most?
Scares?
Scares.
Actually, there is a inequilibrium. This is the tie between the two.
Okay.
This has happened what arranged marriages happen.
Okay.
A spider is an insect, by the way.
Yes. Spider is an insect.
Okay. What irritates Dr. Shahi the most?
wrong answer, I know.
Oh, okay, great. Okay.
Nagging means I'm a big nagger, so I keep irritating him.
Okay. What is the first movie you watched together in the cinema? If you do remember.
I don't think so. She remember, I remember, because we went for a date and all we remember about each other.
But we can talk about one song that he sung to me. Is it all right?
Okay.
Okay, he sung that one song for me.
What was it?
You want to know the name of the song or the movie?
Yes. The name of the song.
That's a Hindi verses. So
Yeah, so it's in Hindi, but people will understand. The movie is the above one is the movie. This is the song.
it's the same.
Do dil mil rahe hain.
No, I sang this for you.
Oh, you did that too, but this was the first
This is
one.
the
All right.
first.
Okay.
Okay. For each one of you, what is the best country that you have visited?
Till now.
Yes.
This country.
Okay.
You visited. He said visited. We lived
I
there.
visited my own country as well.
Okay.
Okay. Draw anything that represents your partner.
Draw.
Yes.
It's nature that represents his nature.
Yes.
That's it.
I'm very, very bad at drawing, by the way. Can I write instead of drawing?
Yes.
The character.
Okay, you can do it.
The red one.
Many, but this is what I believe. He's a calm and a strong-headed person.
Okay, great. Okay, thank you very much for this part.
Thank you so much.
Thank you. Okay, it was our great honor to have both of you here. We have reached to the end of our interview. Small advice that you would like to give your students in a 20-second for both of you, starting with Dr. Shahi.
Okay, since we have been interviewed as a couple, so there's one advice I would like to give in the same scenario, especially for boys. It's your choice whether you marry a professional girl or marry a housewife, okay? But in any case, first of all, if you marry a housewife itself is a profession. So don't consider your wife as non-professional. She is managing your house that you're not capable of. I tell you, any man cannot manage a house. Okay. If she is professional, so she's doing two professions together. Managing your house as well as going out and manage the things up. So in no ways your wife, your life partner is inferior to you. If you take her as your friend, your companion, you will complement each other and both of you will succeed. If you consider yourself superior, the thing will be taken away from you. That's my meaning of having a successful married life.
That's good to hear. How about you, Dr. Neha?
Okay, successful married life is like two hands clapping together. It can never happen with one hand. And my advice to girls, because he's already
Taken her view.
Yeah, for girls, I believe that just be honest and true in a relationship. Okay, this is the base of any successful relationship. In a man or woman, they need this honesty and truthfulness to succeed. And inshallah, initially there will be certain hurdles. It happens in all the marriages. But slowly, when you understand that you both are companion, the car cannot move without the two wheels together. You have to move together. Then only you can succeed and stretch the marriage for more than 80-90 years. And a successful marriage that people people look at you and say, no, they lived happily like friends. So remember to make him and her a friend before then, becoming a husband or a wife and then starting the quarrel. And keep yourself in other people's shoes, Try to imagine what you would do when you are in his position, or he will do when he is in her position. This equality will make the marriage successful, according to me.
Thank you very much. This is something actually we are looking for.
Thank you.
Thank you so much. Thank you so much.
Guys, that was unnecessary.
Yes, you people talk to us.
It is good that you have given us time to talk with you.
Yes.
That's unnecessary. Please, I'll insist.
I love this character. I love this.
This is from Up, I suppose.
Yes.
Yeah. Thank you.